Malawi, which is located in sub-Saharan Africa, is considered one of the world's lowest income countries. The top causes of death among adults and children are HIV/AIDS, malaria, and lower respiratory infections. The burden of disease is quite high in the country, and it is our aim to lower their burden with a complete action plan for 3 specific diseases.
The first disease that we will look at is lower respiratory infections. These are not contagious. However, lower respiratory diseases are. They are developed by bacterium and viruses that enter the lower respiratory tract. Upon entry, these parasites can cause a number of LRIs and in turn is one of the highest factors on the burden of disease in Malawi, and for that reason should be dealt with rapidly. There are many different diseases considered to be LRIs, such as bronchitis, emphysema, asthma, and pneumonia. Generally, these diseases are caused by malnutrition or contaminated air. One prime example of an LRI can be seen with tuberculosis. Once TB is developed, like other respiratory infections, it begins to damage the organs. In essence, a lot of HIV/AIDS cases are related to TB. For example, someone who contracts the virus HIV has a weakened immune system, therefore not allowing them to be able to fight TB. Therefore, if the number of TB cases can be reduced, the number of HIV/AIDS cases will also be reduced. Potentially, some solutions to solving TB and most LRIs would first and foremost be complete isolation of those affected by active TB. If they remain with their families, they are potential threats to infect their loved ones. People in contact with the patient should receive the proper protection when around the patient, whether that be doctors or family members. Next, encouraging sanitation, nutrition, and improvements in air quality would definitely help reduce TB.
As one of the poorest countries in the world, Malawi suffers from a large number of infectious diseases, particularly malaria. The disease is a significant cause of morbidity and mortality amongst the population, ranging from infants to the elderly. In 2015, the years of life lost due to malaria for the adult population was 544,700, and for children it was 108,200. In Malawi, malaria is responsible for approximately 30% of outpatient visits amongst all age groups. People from across Malawi are largely at risk of malaria, mainly because of the influence of the dry and subtropical climate. Vector control, such as insecticidal bed nets and indoor residual spraying, is a significant part of malaria prevention.
There is an average of 12 hours of darkness. Most mosquito species are active from just before dusk through the night until dawn. As a result, it's advised the citizens of Malawi avoid going out during these hours, but if they do, to wear a long-sleeve shirt or apply a protectant spray. Clean water, body hygiene, proper sanitation are instrumental to help prevent getting malaria. An implementation of a safe and clean waste removal program would be beneficial. The suggestion would be to encourage the government and private organizations to help finance methods of sanitation, such as filters for water well and proper garbage disposals.
HIV/AIDS is the dominant cause of death in many developing countries, including Malawi. In Malawi, HIV/AIDS accumulates the highest burden of diseases at 2,118,000 DALYs, 21% of total DALYs of the country. HIV/AIDS is a severe disease that must be addressed to improve the health and well-being of the country. Unfortunately, there is no vaccine to prevent the HIV infection and no cure for AIDS. One of the biggest causes of the transmission of HIV/AIDS for females is because most of the women in the country are getting infected by their spouses. Women in Malawi do not often have a say, leading them to be highly susceptible. For males, the claim is that they are often getting their infections from female sex workers, making women both vectors and victims. For a low-income country such as Malawi, the medication cost is not affordable for the majority of Malawian citizens. Taking all this into account, our recommendation for the government is that first, offer voluntary HIV testing and counseling while keeping the health status of the patients anonymous. Our second recommendation is to educate people about safe sex and provide resources and tools such as contraceptives. Overall, the main focus should be prevention and containment of the disease.